Okay, so I hope everybody can hear us okay. We've been seeing on the chats that it looks like the audio is working. We will have everybody muted for right now. I see that question in the chat just to make sure that we can hear our panelists okay. All right, well, let's go ahead and get started. We are recording this webinar and we will have it up on our website, the CCIR Communities Concerned for Immigrants and Refugees website, which is immigrantsandrefugeeskc.com. So I want to welcome everybody this morning. The Communities Concerned for Immigrants and Refugees is a forum that started a couple of years ago, and it's funded by the Reach Healthcare Foundation, and we are very thankful to them for funding this opportunity for us to work in the greater Kansas City area to build this network that is specifically focusing on refugees and immigrants in our communities that we work with. So today, in light of the times and everything that's going on, we have switched. Usually we have a forum every quarter where we get together in person, bring in speakers to make sure that we're up to date with the up and coming trends and needs for our communities. And we are, along with all of you all, are making sure that we're being safe. And so we're hosting a webinar in lieu of coming together in person. So thank you all, and thank you for joining us in our first webinar. And we're looking forward to having several more in the coming months. So we'll be looking to you all as attendees to let us know what the needs are, who you would like to hear from. So this morning, we have a fabulous group of panelists who are joining us. And I do just want to put the disclaimer out there that all of our panelists this morning are from the Kansas side. And so I know we have many attendees that represent Missouri organizations or are residents of Missouri. So I do just want to make sure that that is known in advance, that our panelists do represent the Kansas side. However, I think it's also a great opportunity for those individuals that live in Missouri to get ideas on what's going on the Kansas side, to be able to do some advocacy and, you know, maybe take some of these ideas across the state lines. We will in our future webinars have more representation of what the needs are and what the awesome interventions are on the Missouri side. So please bear with us on that. So let's go ahead and get started to make sure that we're making the best use of everybody's time. If you have questions, there should be a little box there at the bottom for you to write in your questions that is separate from the chat box. If you can't find it, go ahead and put it in the chat and we will be looking at those as well. So I appreciate it. We have a fabulous group of panelists for you this morning. We're going to start off with Erika Andrade from El Centro, Inc. here in Kansas. Then we have Christina Marsh, who is from Catholic Charities here on the Kansas side. Aude Negrete, who is with us from the Kansas Hispanic and Latino American Affairs Commission. And then we hope to have Dr. Erin Corvo join us from the Wyandotte County Health Department. So first, I will turn it over to Erika to talk a little bit about what they have seen as the needs since COVID-19 in their communities and what their response has been, and to share with us some of those resources. So Erika, I will turn it over to you.
Thank you, Andrea. Hi, everybody. Good morning. I'm gonna give me a quick second. I'm gonna share my screen and hope this all works out so you can see my PowerPoint as well. And then we'll get started. And I think we're up. Okay, so again, my name is Erika Andrade. I work with El Centro. I've been with El Centro for the last 18 years. I'm Chief Program Officer, so I see all of our different programming. El Centro is a nonprofit organization here housed in Kansas City, Kansas, but we also have a satellite site in Olathe, Kansas. Plus, we have a dual language academy for children also in the Argentine neighborhood of Kansas City, Kansas. So El Centro's mission is strengthening communities and improving the lives of Latinos and others through education, social, and economic opportunities. in normal times, our service areas rely around 4 different strategies. So we focus on early education through our Academy for Children, which is a dual language year-round preschool. Currently it is closed, but normally it's year-round. We have community health programs, which we do through our Promotoras de Salud program, which are community health workers, and they focus a lot on community health, information, and education. And then we have our health navigation program, which tries to reduce barriers to increase access to healthcare services, primarily for individuals that are uninsured. Then we have our economic empowerment strategies, which we have some limited emergency assistance. We have some financial literacy classes and some job training programs. We have a new program that was technically supposed to start right now in April, but it's been postponed at least for a while, which was a training program called Go Green to Get Green. And it was training individuals on environmental type cleanup services so that they could then go out and get some high quality, high paying benefit jobs. And then we do work around advocacy and engagement to help our communities to become more informed and civically engaged. So when close to a month ago now, I guess, when things started kind of happening, you know, the kind of our initial reaction, or the things that the emergent needs that we saw from our communities, the things that people were calling in about and walking in about, because we did stay physically open to the public for quite a while. We've been closed 2.5 weeks now to the public, but we're still open for services. We started, you know, right off the bat, we got a lot of calls about immediate job loss. So these were individuals that had a job and then went to no job almost overnight. And so there was a lot of questions about, what does that mean? Does that mean that I will get my job back? A lot of questions that really were not answered from their employer when they were let go, to be honest. Then there was also a lot of our population have self-employed kind of jobs. So they're construction, they do painting, they take care of children, or they make food, things like that. And so they had a lot of questions when all the orders started coming out about what is an essential service. Is what I do an essential service? Am I going to get a ticket? Am I going to get stopped if we're out in the street? So there was just a lot of information that they were lacking. We also immediately started hearing more about needing more food resources. So a lot of individuals that were getting SNAP benefits, or even people that were not getting SNAP benefits, that money was just running out a lot faster now that kids were at home all day long, and so were the parents. So that started becoming, we knew, a need right away. Then of course, you know, as a couple weeks went by, the loss of income to meet basic needs started really taking a forefront. So people started getting worried about, how am I going to pay my utilities? How am I going to pay my rent? This is previous to the executive orders that came out, of course, about shut-offs and eviction worries. So that was a big concern. And then we started getting a lot of phone calls about people needing assistance with filing for unemployment. Even individuals that did qualify to file for unemployment, there was language barriers, there was IT barriers. In Kansas, I'm not sure how it works in Missouri, but in Kansas, you have to do this online or over the phone. So it's not like a form that you fill out. So, you know, individuals that weren't comfortable with that kind of technology needed help. So, you know, and also understanding who qualifies and who doesn't for unemployment. And then just most recently, there was a lot of questions about this federal stimulus. Who's going to qualify? Do I qualify? We did our taxes, you know, and whether a lot of questions started rising about ITIN. So we have a lot of our population. We have been big advocates of applying for ITINs, helping individuals apply for ITINs, making sure that all of our families are doing their taxes. And so they've been doing you know, they've been paying their taxes, paying into the system and things like that. And so they were wondering, do we also qualify for the stimulus? And so there was a lot of questions about that. So we had to basically change and adapt. So we needed to still help meet the needs of the basic community needs, but at the same time that things were rapidly changing and there were a lot of fears. So our first concern, of course, was safety. So we debated internally a lot whether, you know, we knew that it was important that our community needed information. They were lacking information. They needed information. So we wanted to stay open to be able to provide that, to provide some kind of services or some kind of guidance. But at the same time, we noticed that the longer we kept our doors open, the more it was encouraging individuals to be in here. Our lobbies were full. They were bringing in whole families with children. And at that point, we have to start debating, how is this beneficial to our employees, which we're putting in danger. Plus also, we're not modeling the behavior that we're trying our communities to do, which is, you know, avoid going out if you don't have to, things like that. So, but we knew that the connection was still going to be really important. We knew that the Latino immigrant community had little access to up-to-date information in their language in the very beginning. And so we decided to finally, we thought it would be best and the safest to model behavior. And so we closed down to the public, but still open to individuals that would call in and do a lot of our services over the phone. So then we also started doing a lot of the internal things that we were doing before, but through getting out that information, either using social media, Spanish radio, or Spanish TV. So we started doing a lot of videos, a lot of information videos. We know that our community really responds to information on Facebook, and more than just like having a flyer with text, you know, having somebody come out and talk to you like just a regular conversation in a video was really, really helpful. So we started having a lot of that information out there on a daily basis, a few videos a day with just updates, information. That will be here later, but honestly, those having those executive orders done in Spanish and put out there immediately so that we could have the same information to share with our audience came in very handy. And then also we had to change and adapt the services that we were actually doing. So, you know, we've never really done a lot of work behind unemployment. So we had to internally train our staff. How do you help somebody file for unemployment virtually? If you have them on the phone, how can you walk them through the steps? And then we kept hearing about food, that people needed more access to food. So those were one of the things that we knew we kind of had to see what we could do about it. So we immediately decided to focus our area on two things. So we have our Inscríbase program, which we've always done enrollment for food stamps and canned care, things like that. But once we were trained and comfortable, our staff also started doing unemployment. And then any other kind of applications that individuals were gonna need, we started putting that information out there. Give us a call, leave us a voicemail, we'll call you back. We provided our staff with track phones that they could take home so that they could do this work from home and not come in every single day to the office if they didn't have to, but still responding to our clients in a timely manner. And then something that we've never done before, El Centro is not a food pantry, that this is not a type of work that we've ever done. We started our food distribution Thursdays. So it was important for us to still stay committed to our core while meeting these emergent needs. So the Promotoras de Salud have always worked around healthy eating and promoting healthy foods, fresh fruits, fresh vegetables, things like that. And we knew that we had to get the information out to our community about places they could go for pantries and things like that. But we also wanted to make sure that at this time they were still having access to fresh vegetables and to foods that were culturally relevant to them. So we made a partnership with a couple of local vendors, El Dorito, and then also Rio Bravo Grocery, worked with them to see if they would do like wholesale vending to us, and then we would prepare bags with fresh vegetables, and then also like dry goods like rice, beans, and sobas, which is what's familiar to Latino communities, so that they can have them, and we do that every Thursday. We do it here in KCK and in Doletha, so we've been doing that. I think this week will be our 4th week that we distribute. And so we do about 200, 250 bags in each location every Thursday. And then of course, using social media to connect. That has been the best resource, honestly, that we could use right now to get information out there. We've always had a good, strong partnership with La Mega, which is Spanish radio station, but I think it's increased tenfold. They've been at every single one of our Thursday events. Ellie and our other promotoras have been on there talking about the different services and different updates of what's going on, you know, tips, things like that, so that they know what's happening pretty much on a regular daily basis. Univision has also been super valuable. We do tons of interviews with them talking about, the most recent one was yesterday with talking about unemployment, because there's been a lot of questions about that. So we know we need to get that information out to the community in the medium that they are using to get information. And then also doing interviews and making sure that in our own Facebook, we're having constant up-to-date information from the health department, from the state, with information that's gonna be useful to our community. As far as resources, I would say that definitely follow us on Facebook, El Centro, at El Centro KC. And you're free to share any of the videos, to what the community that you think might be useful. I do want to stress that all of our material, all of the information that we put out there is in Spanish, because it's very much so targeted to the Latino immigrant Spanish-speaking population. So I just want to put that disclaimer. But if that's what you're needing to share, to make sure that the people that you know that are speaking Spanish, if you think it's helpful, please share. Feel free to share. If you need more information, let us know. Also, the Unified Government, the Wyandotte County Health Department has been doing some wonderful work with having informational flyers in English and Spanish put up that you can just share also. It talks, and they're different. They talk about like symptoms. They talk about what to do if you think you're ill. It talks about just different resource page. United Way has been pretty good at getting those out also in English and Spanish. Of course, I have all the negative there because, like I said, the Kansas Hispanic and Latino American Affairs Commission has been really good at getting all of those executive orders in Kansas put it in Spanish and put out there almost immediately. So that's also really helpful. And then I just threw one more in there, which is protecting immigrants' families. If you guys are not following them or on their listserv, I highly recommend it. They have tons of great toolkits and up-to-date information, English and Spanish, put out all the time. And not just regarding this, but just public charge, census, anything that you can think of, they have it. And so I put those, which I believe Andrea will be making available after the presentation. So please, ask any questions if you have questions. I would just say that I think information is probably the thing that our community is lacking the most. And so there being a lot of misinformation out there, and just making sure that we're thinking out of the box and using different methods of still trying to be engaged with them in a safe distance without actually doing one-on-one face-to-face interactions, because we really do want to try to model that behavior for our community so that they know that really it's not about having, parties or being in the park and things like that. It's really about trying to stay safe. And also for them to know that it's like, if they do feel that they're sick or something, that there are resources for them, regardless if they're documented or undocumented, regardless if they have insurance or don't have insurance. It's important for them to understand that as well. Thank you.
Thank you, Erika. We do have two questions from the attendees. One of them is, are you guys helping filling job applications, any agribusiness, meat plants hiring? Migrant families may qualify for 3 years of additional educational services at local schools if they get agriculture jobs, including 1 year of college scholarship for the students.
We do, El Centro does host the Eastern Regional for the Kansas Migrant Farm Workers Program. And so Carla does do a lot of the vouchers for individuals, and she's also constantly enrolling new individuals that might qualify in the program. So she would be the person that handles those kind of services and things like that. As far as people that are seeking jobs, yes, that's going through our Economic Empowerment Department. We ask people that are needing assistance with that to leave a voicemail, and then somebody gives them a call and can help them over the phone on how to do those kind of processes.
Perfect, thank you. And then our next question, Erika, is what time is the food distribution on Thursdays? And are the services provided in the Olathe area?
Sure, it starts at 1 o'clock. It's kind of a drive-through, so nobody gets down. They drive their car through the parking lots. We ask two things. We ask for a zip code and how many people are in your household. That's the only thing we're asking them. We're handing them their grocery bag. It starts exactly at 1. The one in the Olathe location is right outside of our building, which is 500 East Santa Fe Road in Olathe, Kansas. And then the one here in Kansas City, Kansas, it's in the alley right behind our building, which is the alley that's between 6th and 7th, right behind Minnesota Avenue. That's the best way I can describe it, because you really do have to drive through the alleyway and then again, it's just a drive-through. Nobody gets out of their cars. We just hand them the bags. The police, both in KZK and Olathe, are helping us, but it's just traffic kind of monitoring. So the first time that they were kind of visible, we noticed a drastic kind of fall in our participation. We just got back on Facebook Live and said, don't be scared. They're not ticketing anybody. They just want to make sure that nobody's being unsafe, because the line does tend to get quite big.
Perfect, thank you. And another question, that is there any help for food for families without transportation?
That's a little harder because we are trying to buy. We were doing the walk-up, but we noticed that people were lining up and it becomes a big, almost like a mob, and it's not safe and it's not healthy. So we for our own safety and for the public safety, we had to kind of terminate that part for this moment, unfortunately. There's just no way to do it safely.
Okay, and then we do have another question that's more of a broader question. How are our organizations preparing for post-stay-at-home orders? So we can ask that to the group, or I don't know if you have anything that you would like to add on that first, Erika.
Yes, Irene has already been very clear that we need to start thinking about this. We have been looking for additional funding. We know that utility and rental assistance is going to be a big deal after, because yes, nobody can get evicted or get shut off right now, but we really are not encouraging people to get big bills like that, because what are you going to do when you owe 3 months of rent or mortgage or 3 months of utilities? So we know that that's going to be a big need. Not only that, we are not apologetic about the type of individuals that we are helping here at El Centro. So our biggest concern, and the people that we're going to be helping the most, are the people that we know are not going to be qualifying for the stimulus, and that are not going to be receiving it, and that don't qualify for unemployment. So, you know, we're really looking for funding, but that is going to be our target population that we try to assist for those kind of needs. And then also the job needs, making sure that we have a board ready to go for all those companies that are going to start hiring again, or that are hiring now and are going to hire it after as well.
Okay. We have another question. If you could talk more about the financial literacy services you provide.
Yes. So, well, right now we cannot do classes, actual in-person classes. So we're trying to work out a way to post kind of classes online to make, we love working with videos, because that's really the best medium. We came to learn for our community. So we're doing right now a series of videos that is just going to be tips about basic budgeting, things like that. But normally in normal times, what it would look like, we would offer 1 or 2 classes a month on different things, whether it be basic budgeting, understanding your credit, how to improve your credit, and hopefully even partnering up with some companies that would do home buyer education in Spanish, of course, everything in Spanish.
Okay, thank you. And then another question is there a flyer for times or dates for the food distribution?
We don't do flyers or things like that. We kind of just announce it on Facebook.
Okay, and is it on
your website? If you follow us on Facebook, you will get all that information, yes.
Another question is, have we seen how the public charge policy is impacting our community members during this time?
We saw it before now. We really felt the impact, I would say, starting last year, is where we noticed that our like our SNAP enrollment for food stamps, our SNAP enrollment numbers decreased almost by 50% when everything started with the public charge. It really did hurt our communities. We hadn't seen a decrease in can care applications yet. And I hope that wouldn't come, because I know how important you know, making sure that especially the kiddos make sure they're having their insurance and they have their vaccines up to date, things like that. But I know that our SNAP applications took a big hit. However, though, we have noticed that since this issue with the pandemic started, our SNAP applications have dramatically increased again. Of course, it's because families are in a tougher situation and they're kind of making those difficult choices that we just, you know, they need the help, the assistance. But no, we had seen that it had really hurt our families. Definitely, but starting since last year, it's not new.
Thank you, Erika. We do have someone saying, are there volunteers needed for the food distribution days?
We would love volunteers, because it's a lot of hard work, but honestly, we're not working with volunteers at this time. Even our promotoras are staying at home. We just want to keep the public safe, to be honest, and we can't guarantee safety. And I think right now we're just kind of managing it with staff. We appreciate the help. One thing that we have been doing, and we did a corporate challenge, and we had a corporate Flex Capital that actually donated to purchase all the vegetables for the event in Olathe last week. And so we are accepting those kind of donations so that we can keep purchasing the veggies that helps us do the events, but we're not looking for volunteers just because of safety precautions.
Okay, so actually volunteering the day of may not be the best option right now, but if people know of others in the community that have access to healthy foods that could be donated to the
Correct.
Distribution Thursdays, then that could work.
Exactly.
Okay, perfect. All right, I think those are the last questions, Erika, that I'm seeing for now. We do have one other one that says, what other languages do you have services for?
Just Spanish.
Just in Spanish, okay. And then we'll get to other languages with Christina Marsh from Catholic Charities here shortly as well. All right, Erika, thank you so much for sharing all of that valuable information and how quickly El Centro was able to respond to this COVID-19 pandemic. And Appreciate the work that you're doing day in and day out, and your staff who are working so hard to make sure that the community members are getting the information in their language and answering their questions that they have. So appreciate that very much.
Sure, thank you.
So next, I am very excited to introduce to you Dr. Corvo, who is with the Wyandotte County Health Department. She is their Deputy Medical Officer. And Dr. Corvo is going to review with us some resources that they are working on in the Wyandotte County Health Department and talk to us a little bit more. So I will turn it over to you, Dr. Corvo. Thank you.
Thank you, Andrea. Hi, everybody. Can you hear me okay?
I think so.
Okay, super. Thank you very much for having me this morning. It's a pleasure to be with you all. You know, at the Wyandotte County Health Department, we've really had to spring into action, as you can imagine, with such a severe pandemic affecting our community. And I first want to just say that we're working along with several other surrounding counties and trying very hard on a policy level to coordinate our efforts as one larger community. And so I appreciate that there are folks from, I'm sure Johnson County and the Missouri side here as well. I think that makes a lot of sense, because certainly we know that it's you know, we're all in this together, and the virus doesn't care which side of the line that we're living on or working on. First of all, I'll maybe just cover some of the ways that we're trying to get information out to our community, and you know, I'm really interested in your feedback and questions as well, and then we can cover access to testing and how that's offered to the community. And then I have a few things to offer as far as like food delivery and volunteer opportunities and such, because we're using a lot of volunteers and very grateful for them at the health department. As far as information, you know, we have been really fortunate that we've been able to get information out through our 311 and 211 number partners. And so if any community member needs access to information about coronavirus, about their symptoms or where to be tested, they can call 311. We've also had a really powerful partnership with Dr. Sharon Lee over at Family Healthcare, which is a wonderful clinic that takes patients without regard to documentation status or anything like that. That's at the corner of Rainbow and Southwest Boulevard. But Dr. Lee set up very early a COVID hotline, and I'd like to list that number off. And anybody in the community is welcome to use that wherever they're from. That can be in Wyandotte County or other counties too. And that number is 913-396-7070. And that's staffed by volunteers. Many of them have a medical background, and she can help answer the kind of medical and symptom questions that come up. And then also, she has been the first really great consistent resource for testing for coronavirus in our community. Now, on the health department side of things, we've also opened up for testing. We're in our second week now, and we're testing really anyone with symptoms of the coronavirus, and many symptoms you've probably heard about, but we can go through some of those as well. That includes cough and shortness of breath, fever, and we're talking about any fever, even lower fevers like a 99 degrees, GI symptoms, fatigue, muscle aches, sore throat, that sort of thing. So we're encouraging you to come for testing if you're feeling ill. We certainly want you to come. Ooh, look at that. Andrea, thank you very much for sharing your screen just in time. I also want to direct your attention to our website. So you may say, well, I can call Dr. Lee's office and get tested, but how do I get a test over at the health department? You can go to our website at wykokck.org. And once you get there, there's a coronavirus button, and you punch the button there, and then you get into this page. And then Andrea, you can click here on self-report your symptoms. That's in Spanish and in English. And this will take you to a page where you can indicate what your symptoms are, and then someone from the health department will reach out to you and we'll get you in for testing, usually that same day that you report your symptoms. So we're trying to work with people to open up access as much as we possibly can. Some people don't have access to the internet, and so you can call the 311 number and get access to this as well. And we're at the point now when even if you were to drive up during our hours of testing, which is 1 p.m. to 5 p.m. 5 days a week, Monday through Friday, even if you drive up, we'll help you go through this sheet and get you registered, and we'll get you tested if you're having symptoms. You know, having enough tests for our community has been a real issue, and we've been pushing really, really hard at the health department to get enough tests for our community. At this point in time, we can't test people who don't have symptoms, unfortunately, but we are testing anybody who is not feeling well and has symptoms of coronavirus. As Erica pointed out, you know, the social needs for families at this point in time are just high across the board. And we realize that with all of the orders to stay at home, many people are experiencing extreme stress financially, and not to mention a lot of our families are experiencing illness right now. There is a food needs request form there that Andrea can show here. There you go. And we've partnered heavily with Crosslines and other food banks and organizations in our community in order to pack boxes for families. And then we do have a delivery system set up, especially for those families who are affected by the coronavirus and are being asked to stay at home. And so if you do have a need for delivery of food, this is a good option. We're happy to help with that. And then Andrea, if you might go back as well one more time here to the home page. We also have an area there that if you would like to donate either your time or other resources to the health department and on it. We've had a real outpouring of support, and we appreciate all of our volunteer help. I would just say be careful. We might actually call you and ask you to put some time in. But here's a way that that we can keep track of everybody who wants to volunteer. We are very, very concerned about our various communities that have experienced systemic racism, a history of inequity in Wyandotte County. And I just want to say that we're working very hard to listen to community leaders in our African American community, our Latinx community, and our refugee communities. We want your feedback. We realize that our testing at the health department and at Dr. Lee's office is what we believe to be inadequate, and we feel that we need to get out into the neighborhoods and do more. We want to know what you need and what we can provide and how we can do this better. We're holding community meetings twice a week at this time. We're very worried that pandemics like the coronavirus do not affect our community equitably. And we realize that we're dealing with more cases in Wyandotte County than other surrounding counties. And so we feel that very deeply and are concerned. I want to throw that out there and thank you all for coming today and listening. But we also just want to express that we're open to suggestion and want to make ourselves available to even creative thoughts for what to do next and how to reach our most vulnerable communities in Wyandotte County and beyond. I think I'll leave it there for questions for now, and I'm happy to answer anything you've got on your mind if I can.
Okay, thank you, Dr. Corvo. So we have a question. Is testing for residents of any county or just Wyandotte?
At the health department, we are testing only Wyandotte County, but I believe Dr. Sharon Lee is testing from other counties as well. And so I would recommend that you would call her line. My understanding is that in Casey Mo, they've got testing at their health department that they're going to be starting, and I know Johnson County is going to be starting that as well. But again, that line for Dr. Lee's COVID hotline is 913-396-7070. Oh, and I want to emphasize too that all testing is free at both sites.
Okay, do you mind repeating that phone number?
Oh, no problem. It's 913-396-7070.
Okay, and we can post that information up as well.
Thank you.
Thank you. We have a question. Where can families get face masks or gloves at low cost or possibly free?
That's a great question. We've been working with a couple organizations that are sewing masks right now, and we're trying to get a bunch of these to give out. I feel like we're behind. They say that there's 60 orders ahead of ours, which is not too encouraging, but I can take that back to our supply chain. Right now, we're having issues supplying even our healthcare workers, and so we're responsible for making sure that all of our safety net clinics, also in Wyandotte County, have sufficient protective gear. But I hear your concerns about also needing masks in community members, for community members. Of course, that is a somewhat new recommendation from the CDC that we all wear masks when we're out and about. And so I'll work on that. And as soon as we can, we'll get something up on our site about where we could access those things. If you all know of anyone who sews, I know that sounds funny, but we have patterns for masks, and we can get those out to you if you think that there would be people wanting to volunteer to make masks for the community.
Perfect, thank you. We have another question. Is there a fee associated with COVID tests?
No, there's no fee. We are taking on that cost as a unified government at this time. We're hoping that we might get federal reimbursement eventually, although there's nothing said about that at this point. But for the person getting tested, there's absolutely no cost.
Okay, thank you.
Mm-hmm.
Can advocates fill out the food request form for families?
Yes, absolutely. I fill this form out often for patients who I see. I also practice medicine over at KU, and many of my patients have benefited from this. I recommend that, for instance, like promotoras or others who are helping people obtain resources do this. I think that that's absolutely a great idea. Mm-hmm.
Perfect, thank you. How fast are results being given on the COVID testing?
It takes about 1 day, about 24 hours. Prior to about a week ago, we were having tremendous difficulty getting results back, and some of the labs were taking even up to 10 days. But we think we've got that worked out now, and so it should be a 1-day turnaround.
Thank you. Will Wyandotte County implement a randomized voluntary testing site similar to what Johnson County recently did?
That is a very good question. We are certainly talking about that. I think that if we thought we could get a representative sample of our community where the actual tests match the demographic of our county, it might not be a bad idea. In fact, I think it could be very helpful. We're also talking to some private companies, such that we could partner on doing a larger sampling of our community. I feel like our work right now is concentrating on building as much trust and inroads with some of our communities that traditionally we haven't been able to reach into as well. I think that that's going to be really important before we go forward on a sample like that.
Okay, thank you. Another question, do you have to have a doctor's order to get the test?
No, at one point in time we did require this, but at this time we're starting to relax our testing regulations and requirements. And so if you do have your own doctor, you're welcome to go there and get tested, or your doctor can refer to us, but it is not necessary. Again, if you feel like you need to be tested or know someone who does, you're welcome to go straight into our website here and just report your symptoms. We'll call you and get you signed up for a time to do our drive-through.
Okay, thank you. Another question, will undocumented patients, those who are not eligible for Medicaid or health insurance, with a confirmed COVID-19 diagnosis, will they be charged for their treatment?
That's a good question as well. I believe that the EMTALA and SOBRA laws would apply in that case. Maybe some of our other panelists could speak more to this. But we are hoping that those laws that essentially would pay for people's emergent health care would then come into action during that time, if that should happen.
And there are a lot of symptoms after a positive diagnosis that can be managed through home care. Is that correct?
Yes, that's correct. Of course, what we're seeing is that some people do have a lot of shortness of breath, which can be a really dangerous and scary symptom. And so if that's what someone may be experiencing at home, if it gets to the point where you're feeling scared or feel like you can't take care of yourself at home, it is time to seek care at a hospital. But otherwise, if your symptoms are less severe, it is okay advised to stay home. And we're even asking people in Wyandotte County to stay home for 10 days and isolate yourself for 10 days past your final severe symptom.
Okay. If families don't have symptoms, can they still utilize the food needs request/delivery service?
Well, it's a good question. We're trying very hard to sort of reserve the home delivery for people who are either elderly and would put them at high risk to go out and shop, or who have pre-existing conditions, or people who are affected by the coronavirus. For instance, if they're ordered to stay home by quarantine or isolation. However, we would take that into consideration if there was a great need, certainly.
Okay. See here, just looking through. See other attendees are posting some of the links, so thank you guys. Let's see.
While you're looking through, Andrea, I also just wanted to emphasize the importance of continuing to stay home, and that we're watching local curves very carefully. These are disease curves as we watch the number of cases and take into account the number of people in the hospital and the number of people who are on ventilators in our community and such. And so I think that we're going to be hitting our peak number of cases probably at the end of the month, around the 28th or 29th is what is projected right now. And so this spatial distancing is really absolutely how you can stop the spread of this virus. And I just want to emphasize again, we are all in this together. And so we appreciate your help in that.
Thank you. All right, panelists, are you seeing other questions that we didn't get to? There is a question if we're looking for wholesale resources for masks and/or testing kits.
If we're looking for what? I'm sorry,
Yeah.
wholesale?
Wholesale resources.
Yes, I mean, we are sourcing most of our personal protective equipment from the state level at Topeka, and I know that they're getting federal shipments in, and so we are watching our supply line, especially for healthcare folks. You know, we're watching that like hawks. You know, we're very concerned about it. So again, for general use in the community, I think wholesale would be a great idea. I mean, if anybody has resources, you know, email me. We'd love it.
Thank you. And Dr. Corvo, I know that currently you all are trying to get an understanding of what some of the concerns that the immigrant and refugee families might be worried about. And so then that way some of the messaging can be tailored directly to those individuals, those communities. So I know that that's something that you guys are also looking for input on.
Mm-hmm. Yes, very much so. Thank you for saying that, Andrea. We're really very interested in this. I know that there has been a lot of fear about some of the orders coming out, and we've had questions of, you know, are police going to stop me if I drive around, or what is that situation? And the answer is no. I mean, there's really many essential functions that people still need to do and still can be out to do. And so we're just trying to put orders in place to keep our community safe. And if there are other ideas on how to message this better, we're really all ears. We're trying very hard to have all our documents translated. If anyone were to call in, we certainly have interpreter services available as well, so no matter what language. But we're open to ideas at reaching all parts of our community.
And Dr. Corvo, something that I heard yesterday that really stood out to me, when our families are calling immigrants, refugees, and we're asking, or let's say they call a hotline or they're self-reporting their symptoms and they're being asked some of their demographic information, race, ethnicity. I think sometimes that can cause a fear for our families because they're not quite sure why this information is being gathered. And it's really being gathered for just a public health perspective. Can you talk a little bit more about that?
Sure, that's a really good point. You know, up to this point in time for our health department, when we had communicable diseases reported, we didn't gather that type of information. We didn't gather race and ethnicity for folks who are suffering with those conditions. For coronavirus, I think that our biggest concern is that there's tremendous inequity in who is being affected by this virus. And so we're trying to gather that type of information in order for us to, first of all, understand what's going on, but second of all, to be able to reach out more to those communities, whether it be culturally or linguistically appropriate ways in order to be helpful. That information is not shared with anyone. It's only kept at the health department for our use in helping to combat the virus. And so I want to ensure everyone that privacy is totally on our minds. And so if that helps increase people's comfort level, I hope.
Yeah, and I would just reiterate that for all of us on the call, that could be a very legitimate concern for the families that we're working with. And so just to assure them that that is data that is being collected so that it can be used for different purposes, but definitely not to turn into any authorities.
Right, and I think it's in the next day or two, I believe tomorrow, probably we will be releasing a press release regarding what we're seeing in our data so far. I can tell you that the number of cases that we have confirmed in the African American community is much higher than we would expect for the number of African American families living in Wyandotte County. I can also say that the number of deaths is much higher in this community as well, which is extremely concerning to us.
And also, from what I understand, the Spanish-speaking families, Latino families, aren't reporting as much either.
Right. We are unfortunately finding that we're just not testing many families in the Latinx community, and we're really asking, what's the deal? We've been working alongside Juntos quite a bit, and Mariana Ramirez has been very helpful in getting our messaging out onto La Mega and to Una Visión and the like. But we're worried, and we're thinking, do we need to do pop-up testing sites, in community centers or churches or whatever? I mean, is there something else that we're missing? I am afraid that a lot of this is fear, which I think is understandable in this community, but we're here to take, again, suggestions and to reduce that fear if we can. We just want to say we're open to that.
Thank you, Dr. Corvo. I do know you have to move on to your next meeting. We just have one last question. What is the age range for children to wear a face mask?
That's a good question. Well, I even see these little babies who are newborn babies, and they have these little face, little shields on. It's actually kind of cute. So I don't think there's any. Well, I mean, for masks like this, I certainly wouldn't use those on infants. So maybe after 2 or 3 years old. It's a good question. We'll reach out to our colleagues in pediatrics and get their expert opinion on that and post it. But I do think that, again, I've seen little hats with little shields that come down. So those types of things would be acceptable, like for infants, things that don't actually cover the face here.
Good point. And what are the times for testing at the health department?
So we're testing from 1 p.m. to 5 p.m. and that's 5 days a week at this time. We'll post if we open up for more hours for testing weekends as well. And it's like a drive-through service.
Perfect. Well, Dr. Corvo, thank you so much for your time and talking through the different resources that the health department is offering, and couldn't imagine how many hours you all are working day in and day out, and appreciate all of your efforts and for keeping Wyandotte County informed and getting testing opportunities out there. So thank you for your time.
Thank you. Thank you, everyone. Thanks, Andrea.
Take care. Have a great day.
You too.
All right, so we will move on with our next panelist. We have Christina Marsh, who is with us from Catholic Charities, and they serve both the immigrant and refugee communities, but she will be talking to us about our refugee services. So we're going to just take a moment for her to share her screen. And Christina, if you can introduce yourself and your role and get started with your presentation. Thank you.
Sure, absolutely. Give me just 1 second to switch over to share. Did not go from the beginning, sorry. Okay, here we go. Okay, again, yeah, I'm Christina Marsh. I'm here from Refugee and Immigration Services. We are part of a larger organization, Catholic Charities of Northeast Kansas. I'll be speaking mostly about specifically activities that have been going on in refugee and immigration services. My role is overseeing case management and also our health and benefits programs. And that case management is typically like beyond their initial few months of resettlement. And I also just wanted to point out as well, like again, as Andrea mentioned in the very beginning, we are in Kansas City, Kansas. However, there are 2 organizations in Kansas City, Missouri that do similar work and serve similar populations as us as well. Those being Jewish Vocational Services and Della Lamb. So I just wanted to point that out, and I will mention them a couple of times throughout this presentation. So going into the key points I wanted to share with you today, first, our services, just in case you may be not familiar with those, or you potentially have a referral with someone that you're working with in the community. I would like to provide a quick refugee resettlement update, because if you're working with refugees who may be wondering about their family members that they're expecting to resettle in the U.S. and how that's going right now, how we've responded to the COVID-19 crisis with current operations for our programming, and then supporting the refugee community, gaps we've worked to fill, and resources that we have used to help support the community and that you could use as well. So moving ahead, just quickly wanted to make sure people were aware of where we're serving. I mean, technically Catholic Charities as a whole is 21 counties in Northeast Kansas. However, Refugee and Immigration Services operates primarily in Wyandotte and Johnson County, and the majority of it in Wyandotte County. And our address is listed here on the screen in case you're not familiar with our main office. As far as our services, you can see those listed here. I won't read through all of them, but these are the different kind of chunks of services that we offer. Talking a little bit about our operations, our national level voluntary agency gave us good guidance in the very beginning, where we're focusing mostly on food, immediate medical care, and cash. For clients, especially those new arrivals, where in their first few months, like there's required services that we would provide, like getting them all settled in their community. And so we've had to kind of look at like what are the most critical ones, and then keeping everybody safe, and then looking to the future on how we can help them with things that were not immediately provided upon arrival that we normally would. So we've had to make some modifications there. Otherwise, we are providing remote services. We just switched to where we have either someone is working directly with the case manager already. They would just be communicating via phone, and we're doing things electronically. We're in the field pretty minimally. I'm trying to keep everybody safe. I'm just focusing on those critical needs if needed. And as well, the services are mostly done via phone. Some of them are not able to be, like our English training classes. It was hard to move to an online format due to technology. And then our youth mentoring program had just kind of started, and so we hadn't really gotten a chance to start introducing people, and we felt like we should just kind of pause that for the moment. So again, these are the services that we've offered. We're still providing the majority of these, just in a more remote, via phone and electronically. Okay, as far as who we serve, I think this is also helpful to clarify. I mean, the majority of who we serve are refugees with that specific immigration status of refugee, but we do have other populations that people might not be as familiar or are aware of that we serve as well. So asylees, and that meaning that someone received their immigration status for protection after arriving in the US. If they do have their asylum granted, then we can also serve them 5 years past their getting that status, as well as Cuban entrants, foreign-born victims of human trafficking. All of these refugees and et cetera, we can serve them 5 years, either for refugees after they arrive in the US, or for the rest of them after they got that status. The other immigration statuses, our legal clinic is available to any immigration status. You don't have to be a refugee to access that. The same as citizenship, you don't have to be a refugee to access that, just in need of applying and eligible to apply for citizenship. So just to give you an idea of who we're serving as well. Okay, moving just a minute to US refugee resettlement news, if this is helpful to you. Currently, the last numbers that were posted during the current fiscal year that started in October and through March 31st, you can see the number of individuals there, about 7,300 who have resettled already in the US. The ceiling for this year is 18,000, which means that the remainder of those would be expected to resettle by September 30th of this year. The issue with that being that currently refugee resettlement in the US is on pause as of March 19th. And so they are reevaluating that every 2 weeks based on the COVID-19 situation. So I wanted to just share this with you. If you have families that you might be working with, I know that, we're Catholic Charities and we work with refugees, but I know that lots of agencies are supporting refugees as well. And if they're asking about family members, that might be something that you can pass on to them, that currently it's on pause. We're hoping that it will return whenever it's safe for everyone. Okay. Just to give you an idea here in Kansas City, Kansas, how things might be affected, because before it was just on a national level, and so locally, these are last year's fiscal year numbers. And so in the bottom left, you can see 2 categories, primaries and secondaries. The primaries are the ones that would be affected by new arrivals. So that's everyone that comes directly to the airport, and then we pick up and start services from there. Last year we were at 160. And then secondaries are people that would migrate from their initial location to Kansas City, Kansas, so maybe because they heard of a job or they wanted to be near friends or family. So those, we had 181 this last fiscal year. So I wanted to kind of compare and show you, last year, currently our projection is 85 to get directly from the airport and be able to assist. It's a little bit lower than last year. Currently we're at 45. So as soon as, we're able to, we will start settling more. However, now we are at 45 for the year. So just to give you an idea locally, if people were wondering about that. Okay, so I'm going to start going into now, how we've worked with the refugee community around COVID-19. So to start, I wanted to show you, what populations make up the majority of who were resettled. Like, these are the top 3 populations. It doesn't include every single refugee that's arrived, but I just wanted to give you an idea of the major populations in our community that we've been supporting. So the majority being from Burma, a large chunk from Bhutan and the Congo, and this is using data from the last 10 years. What's a little tricky is that, people they'll register with us initially, and then of course they are members of the community and free to move as they would like. So, we cannot really ever have a live number exactly of how many refugees are here. If people would like to move or never, wanted to register with us, that's their right and they don't have to. But this gives us the best representative that we can as far as who is in our community now. Okay, so when we started looking at how are we going to assist in sharing information and supporting about COVID-19, we really had to think about a team approach because there is a large number of families, refugee families in the community, and so we had to really look at how we could be most efficient and effective in communicating. It wouldn't be really challenging and not effective if Catholic Charities was trying to reach out to every individual family that we had contact information from in the last 10 years or beyond. Just due to having their current contact info, we really only see them the most in their first couple of years. And then again, they're members of the community and they don't have to come and update us with all their information. So also, language and interpretation would slowly slow that down. And then again, they might only just hear from us once if we were just gonna, try to reach out to everybody one time. And, obviously that's not the most efficient approach. So we really had to think to ourselves, who could be part of this team approach and assisting. What would Catholic Charities' role be and what would other roles be in this? And so Catholic Charities really aimed to, be the one that could help them get clear, concise information if that was needed. And so if a client was working with a case manager, so they were new in the last 6 months or so, we've been reaching out and communicating with them more directly in all of this. But beyond that, we identified refugee community leaders that could assist. So a refugee community leader might be a pastor. It also might be someone that has a higher level of English and has, just kind of become a leader in their community and assisting others, and understands systems in the community and things like that. So community leader is not like one specific definition. So we started with a round of calls to our community leaders, asking them, is your community aware of COVID-19? How are people responding? What support do you need? And I'm happy to report that many of them were well on their way to already being somewhat aware of what's going on. At that time, people were looking at, already canceling churches and services and connected to getting CDC updates. So they had communication going on in their own networks. So we were really pleased to see that. Others needed some more support in getting rumors addressed, helping to get a little more organized, and needed help with messaging. So in order to help with that, there were a lot of things that had been translated, but it was, we really wanted to try and give something that was concise so that they weren't having to kind of piecemeal together, like, here's what you do to prevent it, here's what you do if you're sick, here's this about the stay-at-home order. So we consolidated a lot of the things down for those that needed it, and were able to get that translated so that they could share with their communities and beyond that, pastors and their own congregations as well. So I feel like that was really helpful in order to get them some concise information, all consolidated to share out with their networks. Yeah, so again, and then after that, we did provide the translations for them. And then they could choose, this is the thing, they could choose what works best in their community for how they're going to share that. Some communities have, their own already, like a church has an email listserv that's set up, or a messaging system that's already set up. So they were able to do that. Some, have a Facebook page that they regularly report and look at. Others, started off with kind of more phone trees, but then to get the word started, and then, we're referring to their Facebook pages and things like that. So, so this is the approach that we took, starting figuring out what would Catholic Charities do, how can we be most helpful in getting clear, concise information, and then how can those community leaders assist, and ultimately the refugee community getting the information that they need. I learned that one more layer that we did as well was communicating with landlords that we knew provided housing for a lot of refugees in apartment complexes, and providing those translations as well so they could be posted, and calling and talking with all of our interpreters as well. Many of those are also community leaders, but some are not, and so that they have that information and, continue to share. Like, basically just getting information out. Information is key. And keeping people safe. So that was our approach. Okay, so a few notes. I think I mentioned some of these, again, that the refugee community, a lot of them were already in motion to help inform, and some of the methods that they were using to communicate with their communities at large. Okay, so gaps that we've worked to fill. So we've, worked to assist where agencies have changed their operations. So, one thing our case management team has really been trying to do is make sure we understand how all the agencies that we've been referring to currently are, how have they changed? Because in the past, if we made a referral, we were really familiar with that process and how we could guide our refugee clients in doing that. So as that changed, we had to keep informed of that, and we kept like a central Google Doc to update all of our staff. A couple of key locations was with public benefits, maybe school enrollment. We kind of switched some to, as Erica mentioned before, helping train our staff to do more public benefits applications online. We've been doing Medicaid, but we hadn't been doing food and cash because people have been going down to the DCF office. So our staff have been, learning how to do that, and normally we wouldn't be able to provide that service, but we've increased capacity to be able to in this situation. Also, like if kiddos haven't been enrolled in school yet, working with the school district, we've had a great communication with them to make sure that we understand the process and we can help refugees to start the process online, or they might have some technology challenges. Unemployment applications, again, mirroring El Centro as well. This has been a big question that a lot of people have had. And so, we have an employment team at Catholic Charities, but we've expanded that to some of our case managers have also learned how to apply for unemployment and assist people. One of the big challenges, it's hard to be able to do those weekly claims after the initial unemployment application is filed. So we wanted to be really mindful of like, okay, we're starting this for somebody, but how are they going to keep up with it? So we agreed that we could start the application and then kind of the same way, like helping to train some of those community leaders on being able to do the weekly follow-ups in order to be able to help people keep up with their benefits. Connecting parents to school equipment. If people maybe had a language barrier and didn't quite understand or couldn't be reached to understand that that was available from schools to help education keep going. Employment support as well, in that we have an employment team, so we have the benefit of if somebody is having a challenge with their employer, wondering if they were still open, were they essential, am I getting laid off temporarily or permanently, what's going on. Sometimes it's a little confusing due to language barriers, and so we were able to be like a liaison with those employers if needed. And the next thing we're working on now is that stimulus check, understanding if people are eligible or not, and how they might receive that, or if they are eligible. So we're kind of still working through that, honestly, to best inform everybody, but that's another thing that we're trying to fill the gap. So I mentioned before that we were sharing a lot of resources after we had given people summaries and they were able to verbally share with some of their communities. We wanted to continue a flow of good translated materials so that they could post those and continue to email those and share. And so these are some of the sites that we've been using that have consolidated a lot of things. So there's a lot of great things out there. It's kind of hard, one site doesn't have every language, everything. So Communities Concerned for Immigrants and Refugees has a lot of those things consolidated on their site, and I'm going to show you that in just a minute, kind of how you can navigate that, as well as Switchboard. And then Wyandotte County Health Department was on earlier talking about their translated resources, and we saw their site. So I'm going to try to see if I can quickly switch over here to where I can show you the Communities Concerned for Immigrants and Refugees site, just so you can kind of see what's out there and what languages are available, if that's helpful to you. So if you can bear with me just 1 second, hopefully that will work okay. Okay, hopefully you can see that okay now. Okay, so looking at this, it's organized by category. I'm just going to go to a few of these that we have used. So what to do if you are sick. These are from the CDC. And so you'll be able to see, one language that's common in our community is Swahili for those from the Congo. So that's available there. Also under videos, let's see here. Yeah, so videos, coronavirus 19, if you look at that, there's a lot, there's a nice concise video on what coronavirus is, how to protect yourself. Again, in Burmese, Nepali, Swahili, and those were our top 3 populations that we were working with. So we were really happy to see those. Kinyarwanda, which is great because it's another language spoken in the Congo that's rare to find. Resources translated into those languages. So I just wanted to quickly kind of show you, because it's nice to see things visually sometimes, what is out there. So, so that's Communities Concerns for Immigrants and Refugees website. I'm going to try and switch back now. 1 second. Okay, great, we're back. Okay, one other resource that I don't think is posted yet that I wanted to highlight is this. There's an interview with Kansas City physicians that is also was done by Jewish Vocational Services. And so that is basically they had two doctors, one Swahili speaking doctor, and another doctor I think was from Truman Medical Center. And so with that, you know, they were able to answer things in Swahili that were rumors in the community that we're trying to address, like if I'm young, you know, should I be worried about this, things like that. I think that's really helpful. I'm going to try and look and see if we can get that posted on CSER as well. Okay, so lastly, you know, how can you help if you're wondering, if you're feeling kind of like, what can I do to help refugees as well? So you can share resources with refugees that you're working with, some of those that we've shared, and checking back with them to give them updates. Like I mentioned before, we kind of gave like an initial, like, you know, here's, you know, what you need to know about how to prevent and how to keep yourself safe. And then there was the stay-at-home order in our area and the state order as well. So we circled back and we're, you know, how is everyone getting that information and what can we do to support? So circling back with people, you know, as much as you're able is really helpful with new questions that might have come up. Helping them recognize scams. So unfortunately, things like this happen and people take advantage. Most recent scam that we've seen is, you know, the IRS like calling, supposedly calling and wanting your information so that they can provide your stimulus check. So helping to educate people about those scams, that you should never provide your personal bank account information and things like that over the phone to someone calling you. Another thing, I mean, I know that everyone's job right now is a little different. If you do have downtime, you know, learning more about refugees at switchboardta.org. This is a great central location with lots of trainings and webinars and materials to increase our knowledge about refugees and helping to support them. And a few, you know, websites for Catholic Charities, JVS, and Della Lamb if you want to donate, or if you want to volunteer. You know, our volunteer opportunities within the refugee program are suspended, but Catholic Charities as a whole, we are still doing food distribution through our pantries. If you are able and wanting to do something like that, there are also Catholic volunteer opportunities and how to do that on Catholic Charities site. As well as I'll mention, there's some employment resources on there, like places that are hiring and things like that, and like things related to you know, financial related questions that might be helpful to people that you're working with and navigating those things. So you might take a look on Catholic Charities site. Lastly, I'm putting our hotline out there. This is what we've been using in order to provide remote services, 913-621-1504. If you are working with a refugee or an asylee or anyone that's eligible and that's in the last 5 years, they've either arrived in the US or since they've gotten that status, you know, please call that number if you're not sure how to guide them, or if they're not sure. A lot of it's, you know, are they sure if Catholic Charities is still open? You know, we're trying to get the word out about that, but it may still be questioned. Feel free to reach out to us as well. And that's the end. So thank you. I don't know if there's any questions that I can help answer.
Perfect. Thank you, Christina. Let's see if there's any questions here. There's a comment that KDHE website also has resources in a variety of languages. There was a question about what citizenship statuses are eligible for the stimulus checks, and Erika responded to that about what the IRS website says. What about mixed status families where kiddos have a social security number but parents only have an I-10? And that is probably a question about the stimulus checks. If any of the panelists know that answer.
Yeah. I mean, I've just been looking at irs.gov. I'd like they've got some good Q&A. I don't know, Erica, if you're more familiar with that.
Yeah, because we're also a VITA site, so we've been getting some information. And basically, if the tax preparer, so the parents are doing their tax preparation with an ITIN number, they will not qualify for a stimulus check.
Thank you. Can you share access to the information that you provided to the refugee community leaders?
Sure. I mean, I'm happy to do that. It's mostly just kind of like taking, yeah, like consolidating all the things that we would find on the different handouts that were out there and putting them together. So they had a good like consolidated starting point, but I'm happy to do that if that's helpful. If you want to reach out to me, my email address is on the screen now. That'd be fine.
Okay, so that's kmarsh@catholiccharities.kansas.org.
Mm-hmm. Yeah, don't forget the KS. Sometimes people forget that and they don't get to me. So.
Good point. And that question came from Rachel Pierce.
Okay.
Okay, our next question is, how are refugee families handling schoolwork and connecting online?
Yeah, you know, I would say like, I'm not 100% sure the answer to that question. That hasn't been something that has come up as like a main concern to me so far, but that does not mean that it's not. We have a refugee school impact program that unfortunately it's not under my umbrella to be able to speak really specifically about. Mostly that I know about that though is just like those clients that were participating in that program, they would be new arrivals. Like we were really helping to try and make sure they knew that they had access to those materials and like how to go and get them. You know, there's always going to be, you know, some technology challenges, you know, with the community in general. If the students had already been using those kind of things in the classrooms, like there may be more ability to use those. I'm sorry, I can't specifically like give you a lot of detail about that. That's just what I know as far as what we have been doing. I can try to get more information about that if you are, you know, in a agency that would be helpful to get that information to you.
Perfect, thank you, Christina. We have a question, is the hotline multilingual?
So it is not when it's answered. However, the person that's answering it is the receptionist that's been, you know, working with us for 10 plus years. So she's really used to being able to navigate language needs. And so, you know, we're able to get at least enough information. It's not, if your needs are not necessarily addressed in that initial call, it's basically taking the contact information and then the case manager will respond back with an interpreter. So if we can at least get, you know, the phone number will pop up on caller ID. And if we can at least get a name, you know, then we can call back. Even just the phone number is helpful. So we can call back and clarify the language if need be.
Okay, perfect. It looks like there's a Burmese/Guarani speaking parent that may need some resources.
Okay. Yeah,
Okay.
please reach out to us.
Perfect. Well, thank you, Christina, for giving the up-to-date information on how Catholic Charities has responded. Appreciate you sharing all of those resources.
Sure, absolutely.
Thank you. All right, so next we have Aude Negrete with us, and she is the Executive Director of the Kansas Hispanic and Latino American Affairs Commission. So we are very pleased to have her with us because Aude and her team have been working very, very hard to make sure that all the information is translated into Spanish. And so we're excited to hear from her. And so Aude, if you want to unmute and I'll ask you some questions and we can share some resources.
Certainly. Well, first, thank you so much for inviting me and letting me be part of this conversation and make sure that we're getting information out to the community. I really appreciate it and appreciate you putting this together. So a little bit about KLAC, or the Kansas Hispanic and Latin American Affairs Commission. We are within the governor's office, and we're a bipartisan commission made up of commissioners and technical advisors that cover the entire state of Kansas. We have leaders all over the state that we work closely with, as well as cabinet secretaries and the legislature. So as our response has come, we've been in contact with the leaders, but also with the cabinet and with the governor's office to make sure that we're being that link between the two. Through the last summer, we had a series of listening sessions, and one of the things that came up in just about every location where we talked to the community was that it was very important to have information that was bilingual. That was really, regardless of the location, from Garden City to Wyandotte County and everything in between, people were concerned about not fully understanding communication. So something that we've been doing with the response to COVID-19 is ensuring that we have materials in both languages. And then we go a step further and make sure that we are also being culturally sensitive. And it's a work in progress, but we've been able to put together a team of graphic designers and translators to ensure that we are responding to the community's needs. The first thing that I wanted to point out was the executive orders. So the governor, I'm sure everyone's hearing about all these executive orders that she's signing in response to help the community. And we've been able to start providing those in both English and Spanish. The Spanish, we do have to translate it, so it does take about 24 hours for us to turn it around, 24 to 48, and they're posted on the governor's website. We also have been working with KDHE, and they now have press conferences available with Spanish subtitles. So the community can go, we haven't been able to do it real time, but you can go after the press conference is over and see exactly what Dr. Norman and the governor have shared with the community with subtitles in Spanish. Through our Facebook and listserv, we've also been translating all of the press releases, because the executive orders are very legal documents, right? They sound technical, and they have language that, even though it's your own language, it doesn't always make sense because it's so legal. So the press releases are a little bit easier to digest, and we do turn those around right away. I think Erica mentioned that we really try to, as soon as it comes out. Sometimes it takes us a little bit more time because there are a lot of things coming in and out of the office, but as soon as possible we get them out. And that's going to be a synopsis of what the executive order is. So if you are having people that want to know what's happening, I encourage them to subscribe to our listserv or go onto our website, and all the COVID-19 related response press releases we're putting there in both languages. We also have a hotline through KDHE and the governor's office with interpreters in several languages. So this is not supposed to take the place of a doctor. It's for general questions. So for people that have general questions as to what they should do, or general questions related to KDHE, how to react, what the guidance is about COVID-19, where to go to the doctor, what's your closest community health provider, all of that, they can call our hotline. We are also working with the CADEM, which is the Kansas Department of Emergency Management, along with the Kansas Department of Health and Environment, to increase our bilingual and culturally sensitive resources. So I will be posting those on our Facebook as they get released, because I know that oftentimes we feel like there are so many different guidance coming in from so many different places, and then it's changing from day to day. So as soon as it comes out, we try to post it in both languages. That way the community knows. And we have graphics as well as text in both languages. At the end, we're going to send out a list of resources. One of the most important resources is going to be the KDHE website. They are, as soon as something comes out from the governor's office, they'll post it there. And that is going to be the KDHE Coronavirus Resource Center. And for the resources that we are translating alongside KDHE and KDM, we're putting them there as well as on our Facebook and our other media. But that website for KDHE is going to be really important, because that's what we're trying to make the centralized location for all our materials. We have also been working very closely and have a very close partnership with the Kansas Department of Labor. They have been really great at really ramping up their capacity in Spanish. They have always had representatives on the phone that can speak Spanish, but within the last weeks, as the unemployment claims have increased, we have also been we put out the application in Spanish on the website, and they're working. We've also been working with them on creating, translating FAQs and getting them out to the community about the Department of Labor and unemployment insurance, which, I mean, it's so important right now to get the right information out there and to make sure that people know what's the latest, most up-to-date information. We've also been working with them on talking to the media across the state to make sure that we're getting our information out there to the community as to what's happening with unemployment, how to apply, who qualifies, and all of that. And they are, as we ramp up efforts, they're also working on translating the entire website. So that's a work in progress, but it's really important to highlight just how important it is for us to make sure that our community understands the content we're putting out there. I've also been asking our community leaders in the community to send questions to us, because I know that since I can't be out there with talking to everyone, I need help getting questions in. So if you know of questions that the community is having repeatedly, they're frequently asked, please send them our way. That way we can put together FAQs and put together materials in both languages that help our community better understand the updates that are coming out. And I wanted to make sure I emphasized one last thing, that right now, I know that this is kind of buried in the shuffle because there's so much happening, but the census is really important. And I wanted to emphasize that a lot of the COVID-19 resources that are being distributed are distributed according to how much people have answered the census in the past. So we want to make sure that we get those resources as we move forward. We have to make sure our community does fill out the census. So as we're pushing out all those resources, I would encourage everyone in the community to also not forget about the fact that right now we're still, the census is still taking answers, and those answers will be used to later on provide resources and distribute resources throughout the country. And the last thing I wanted to talk about is that KLAC is getting ready to appoint new technical advisors and commissioners. And we, by statute, are bipartisan and spread out across the state. So if you're interested in being part of this liaison organization, please feel free to send me your resume and send me an email. My email is aude.negrete@ks.gov. and you can be part of this organization that helps the governor and the agencies as well as the legislature to make sure that we're being that link with the community.
Perfect. Thank you, Aude. And
Thank you.
here is a list of the resources that Aude referred to. These will be posted up on our website as well. So that'll be immigrantsandsrefugeeskc.com. So please make sure to distribute these to the families or other community leaders that you're working with. Aude, we have a couple of questions. How does KLAC verify translator credentials? But they wanted to make sure to say that the current translations are so well done, but this person might have some volunteers that want to help with those language skill needs.
Well, thank you. I really appreciate people that want to volunteer. For contracts with the state, we have to go through the Department of Administration. And the Department of Administration, we have a person that works through the pricing and who is qualified, and they work through the exchange of and the contracts of how long will it take to get translated and whether or not the quality is up to par and all of that. That said, there have been in the past month times when we have had to increase our capacity significantly, very quickly, and the community has needed the information now. And we have not had time always to wait for the translator contracts to get done and so forth. So we have been working with some people in-house at the different agencies, CADM, CADL, and myself, and the Kansas Hispanic and Latin American Affairs Commission. So we have been doing a little bit of, I guess, volunteer work when it comes to translations, but the bulk of it and really the goal is to get to a point where we're able to sustain our capacity through these contracts through the Department of Administration. That said, there are times when, a pandemic happens or an emergency happens, and we really need to get a lot of information out. So if you would like to help, please feel free to send me your information, and I'll keep it with, I do have a list of people who have stepped up and said, if you have a lot of documents that you need to get done really quickly, we can help. So feel free to send them my way.
Perfect.
So feel free to send me your contact information, and I can put my email down here in the comments so people can.
That's a great idea. Thank you, Aude.
Thank you.
While you're doing that, we have a question. Is there a new deadline for the census?
So I have a census meeting tomorrow, but my understanding as of now is that constitutionally we cannot change the deadline. So some of the operations have been postponed. So things like knocking on doors. So in the middle of a pandemic, you probably can't have people going door to door. That's not safe for the workers, and it's not safe for the community. So some of the operations have been postponed until a later date. But my understanding is that as of now, we cannot change the actual deadline. So it's still, and that's why I feel it's so important to continue bringing it up, because we can't let it get lost between the shuffle of all the other stuff. And it will be very important when it comes to distributing the resources in response to this crisis.
Thank you, Aude. We have a question. There have been a lot of questions about how it's best to follow up on unemployment applications. I know there have been some videos out there talking about what the DOL is doing to take action, but what would be the best message or resource to share with those that want to know how to get a response? Yeah.
I would encourage you to follow CADL on social media, because they always have the most up-to-date information. If their website's done now, within a few minutes, that they'll have guidance on their Facebook as to how to how long it's going to be, when to best follow up. There have been, yesterday specifically, there were a couple of times when they had to take down the website in order to increase capacity and work on it. And those announcements are done through their Facebook. I also have been trying to share all the information that's pertinent on our Facebook, the KLAC of Facebook. So I translate whatever the different agencies are saying and trying to communicate with the community and translate it to Spanish, just to ensure that our community is also getting the same information as those people who do speak English. So that's and then continue and on the Facebook, they'll also tell you when the best time to call in is, how to, if it goes down or anything like that.
Perfect. Thank you, Alde. Let's see here. I think this question is for all of the panelists. Are you guys expecting an increase of internal mobility coming to the KC metro area due to the shutdown of meat plants like the one in Sioux Falls?
I have not heard about that.
I have not heard about that yet either. I think, is that from Alejandro? And
Yeah.
I know that you're, I think, really connected and understanding with migrant in your program and migrant workers. So I was happy, I guess, to like hear that update, to be aware of it, but I have not heard of anyone specifically reaching out about plans to move to the area or like groups of people planning to move. But thank you for that update.
Yeah, I would also be surprised if people were trying to move in the middle of the pandemic, but I have not heard one way or the other.
Well, that would be great for something else for us to keep our eye on and see what that will do, because that will the shutdown of meat plants is going to impact many of the families that all of us on this call are working with. Thank you, Alejandro, for that question. And then also Alejandro has provided a link to COVID information in several indigenous languages from Mexico and Central America. So we'll post that one as well. Okay, well, this is great. We have 10 minutes left. Thank you to all of our panelists, and a virtual round of applause to all of you. I appreciate your time and sharing your expertise in your different areas. And to the attendees, thank you all so much for taking time to kind of work through what our agencies are doing and sharing resources. We hope that you all will continue to share the resources that have been talked about today. Please visit our website at immigrantsandsrefugeeskc.com, and then also if you can like us on our Facebook, as well as the other Facebook pages that have been shared today, so that we can all all in this together, as all of you know. And so it's just going to be most important for us to be abreast of everything and all the resources that are out there that we can pass along. So in closing, just wanted to thank everybody again, and just remember that we are all in this together. We will be sending out a survey link so that we hope to hear from you all on opportunities for future webinars. We know that we want to have one that is more focused on the Missouri interventions and resources. We don't want to leave Missouri out. We also want to have a webinar on the mental health impact for our immigrant and refugee families. So please keep a lookout for all of those upcoming webinars and share the opportunities with your coworkers. So thank you all, and we'll look forward to seeing you all again soon. Please reach out to any of our panelists for any questions or resources that you may have. So thank you all. Take care.